Hi, hello Central Oregon Medical Society. Thank you for joining us tonight for our healthcare forum. All candidates for State House and Senate representatives running to represent us in the Tri-County area were invited to participate, and I'm grateful to those who are here this evening with us. It is important for all of us to remember how politics affects our practice, and I hope tonight's discussion helps us to make informed decisions when we fill out our ballot. I also want to thank Emily Cureton from OPB for volunteering her time and energy to moderate. With that, I'll pass this off to Emily.
Thanks so much, Amy, and thank you to everyone for being here. I'm Emily Cureton. I'm OPB's Central Oregon Bureau Chief. My job is to report on a really broad spectrum of issues in this region, and it's an honor to be here with you tonight. In the spirit of our urgent times, we are going to jump right in and let each of the candidates introduce themselves by way of answering an opening question about healthcare. We've got 2 sitting state representatives with us, plus 5 candidates who don't currently hold office. Candidates, we've just sort of gone over things, but please keep your responses to around a minute so that we can cover lots of ground tonight. And I also want to hear from all the providers and healthcare professionals and super smart people in this room right now. I know that we've got a lot of them, so please put your questions in the chat as they come up, and we will toss them to the candidates through the course of the conversation. So jumping right into it, this first question is foundational, I think, to the rest of our evening's discussion. And it's, what do you believe the state legislature's role in healthcare should be? And fair warning, if you do go over that minute mark, I might jump in and interrupt you. So I'd like to start with Representative Vikki Breese-Iverson from House District 55. Representative Breese-Iverson is a Republican serving all of Crook County and parts of Deschutes, Jackson, Klamath, and Lake counties. Welcome to the forum, Representative Breese-Iverson.
Hello. I feel like I jumped in right in the middle here because just as I got in, you called my name.
I know, sorry about that. I had my script written. So the question on the table, if you don't mind still going first, is what do you believe the state legislature's role in healthcare should be?
You know, when it comes to the state legislature and my district that I represent, I believe that as we look at the state as a whole, we have to remember that our state is very diverse. It's large. We've got a diversity of geographic and populous areas. And I really think we need to look at each option in an ability of local control. How do we take this and make it fit across the state? Doesn't always work if we can't look for some local controls in there. So I would look at each option individually. I'd look at it for the base of what it is we're actually looking for. And I think that as we look at that, we have to protect our most vulnerable. And for me, that's my rural Oregon. That's my small communities.
Thank you so much. Let's jump over to the other sitting state representative with us. Representative Cheri Helt is a Republican from House District 54 that serves Bend. Rep. Helt, what do you believe the state legislature's role in healthcare should be?
Thank you, Emily, for the question. Thank you, Emily. Thank you, Emily, for the question, and thank you, Amy, for putting the format together. I want to start out by thanking all of our healthcare professionals for putting themselves, their service above themselves, and really through this COVID crisis, working so hard on our behalf. And your selfless service has kept our community safe. And so I just wanted to start out by saying thank you. My first term in office has really been defined by public health. I've brought forward a vaccine legislation to make sure we have herd immunity in our state and that we are removing a personal exemption. And I've worked with many of you on this call to do that. I also worked on including veterinarians in the PDMP, on a bill with many of you on that as well to make sure that we're tackling our opioid crisis. And then I've also worked towards banning flavor vaping products. And I am getting the hand from Emily, which means that I have to wrap it up. But I think that public health has been my top priority in the legislature and will continue to be my top priority. And I am honored to work with you on legislation that you want to bring forward and have. So thank you for that minute.
Yep, and we will have more time today, and I think in the future I'll use this. This will be the marker of 1 minute shame. Or for the wrap it up marker, if you will. Let's go to Jason Kropf is the Democratic nominee for House District 54, serving Ben. He's running against Rep. Helt. Mr. Kropf, please get into your philosophy on the legislature and healthcare.
Thank you, Emily. Yeah, I mean, I think when the state's role in healthcare is it's this holistic view of how do you promote health and well-being throughout the entirety of Oregon, right? So part of that is making sure we have the Oregon Health Plan to help those who are the most vulnerable, who don't have access to health insurance through other means. It means making sure we're making investments in public health so that we are tackling large-scale issues. And I also think it means working hard on the social determinants of health. How do you create stability for people? How do you make sure people have housing? How do you make sure people have real educational opportunities and economic opportunities? How do people have access to food and not be food insecure, right? If you can create stability in people and you can help with those sort of basic needs for those who aren't able to provide them for themselves, I think we know we get better health outcomes for our entire community. We also know that we spend less money on direct health services when we make those types of investments. No pin, right?
No pin. Although I did forget to set the timer, so thanks for staying tidy there. Let's go next to Eileen Kiely. She's running as the Democratic nominee to be Bend State Senator in District 27. Please tell us about your view on the state legislature's role in healthcare.
Hi, I'm Eileen Kiely.
Kylie, sorry.
And that's all right. It's a hard name to pronounce. I want to dive right into the elephant in the room, which is single payer. We know that the most cost-effective way to deliver health outcomes and what's working for every other developed nation in the world is, in fact, single payer. But what that looks like is different in every single nation in the world. And I think Oregon has an opportunity to lead here, working on what we've already done with the Oregon Health Plan, to develop a glide path for single payer within Oregon and allow the states to actually handle that for their various environment. I am on the marketplace. I pay $778 a month for premiums, and I still have $7,000 out of pocket for medical and another $7,000 for prescriptions. That is not affordable for median families, especially for families that have people who have chronic illnesses. My corporate experience says you don't get to do that in one step. There's not going to be one vote. Oh, I see the pen. So I think I'll get back to that because I actually think that we do have a glide path, and I think that state is the right place for us actually to start doing that, so that we can control costs and figure out what's the right plan for Oregon.
Thank you so much. Carina Miller. Carina is running for the Democratic nomination for Senate District 30, the largest Senate district by area in the state. We're talking about all of Baker, Grant, Harney, Jefferson, Malheur, and Wheeler counties, as well as parts of Deschutes, Lake, and Wasco counties. Carina Miller, what do you think the role of the state legislature in healthcare should be? And I now apologize to all of you for asking you to express this in 1 minute, but let's keep rolling.
So I'll just jump right in. Hopefully you can hear me. Yep, it looks like you can. So, piggybacking off of what Eileen just talked about, obviously having healthcare that's accessible to all families and isn't going to hinder people's ability to provide a stable living is important, but specifically for Senate District 30, it is a large district, and there is an actual need for actual healthcare infrastructure, just access to these services for a lot of people, and then further expanding that into mental health services. COVID is really exposing the lack of resources in our district, and we're not even talking about the mental health issues we're facing. I'll just stop there because I always go too long.
Oh, you were very tidy, but we'll go ahead and we'll be circling back to a lot of things. Let's go last but of course not least to Hugh Palcic, the independent and the Democratic nominee, I believe. And Emerson Levy, let's not forget Emerson. But first, Hugh, you're seeking office for Senate District 28, serving all of Crook, Klamath, and parts of Deschutes, Jackson, and Lake counties. Where do you weigh in on this very big question of the state legislature's role in healthcare?
Well, thank you very much. I think that for the state, I think that healthcare is central. Public health is very important, and I think that when I look at the legislature, I look at it being a quality of life business. representing a rural area such as I am, I look at the needs differ. So it is broad-based for us, whether it's access to healthcare, and especially, there are other factors, social factors that apply when we look at our healthcare issues in rural areas. So I look at our state having a significant role, and I'd like to see it be very comprehensive and unified as we move forward, as opposed to something fractured by area by area. And that's going to take more time and work to draw up those plans.
Thank you so much for that. And of course, last and definitely not least, Emerson Levy is running on the Democratic ticket for House District 53, which is Deschutes County minus Bend. Hey, Emerson Levy, what's your take on the role of the state legislature in healthcare? Oh, you're on mute. Got that one out of the way. That's good.
It's usually not me. I'm sorry. Thank you, Emily. I am so excited to meet you in person. So just to be quick and tidy, I believe that healthcare in our legislature is essential and vital. We need to focus on accessibility, affordability, expansion of mental health services. And to swing back to accessibility, that also means telemedicine, so the expansion of rural broadband so that we have more telemedicine access. To stress the importance of vaccines from a leadership level, as we've seen the anti-vaxxer movement increase in Central Oregon. And we need to promote public health, and I believe, I'm not sure if I said, to really advocate for a reasonable price on prescriptions.
You have about 20 seconds left if you want to add.
Oh, yay. Okay. So really, when you talk about mental health, I want to talk about moving to a prevention model. About 17% of our budget goes to the effects of addiction, and only about 1% goes on to prevention and recovery. So I think we should shift that model to a more progressive prevention model.
All right. Well, thank you, everyone. Now I've got you all nice and concise and used to that 1 minute response. We are going to shift into a slightly looser format and hopefully get some engagement from our participants out there with your questions as providers, as healthcare professionals. What do you want to know from people who want to be your state representative or your state senator? So just drop those into the chat as we go along. And now the format shifts. We're going to I'll throw out a question and direct it to one of you, and try to be tidy, but I probably won't be running as tight of a clock. And then for the rest of, if you're not throwing the question first, feel free to engage and converse with one another as colleagues and as people who are interested in these issues and want to hold leadership positions in our communities. I'll just be keeping an eye on the clock and wielding the marker of wrap it up as we need to move on to the next question. So first of all, I think a huge issue that we're all sort of in the dark about what's going to happen with is the Affordable Care Act. If it is struck down or repealed, what would you like to see the state of Oregon do in response? And on this one, if you don't mind, I would start with Carina Miller before we open it up to the group.
So I actually cut out for 1 second. What was the question again?
If the Affordable Care Act is struck down or repealed, what would you like the state of Oregon to do in response?
So I know that this question has come up before, and there could be some opportunity for us to provide some of these resources for families in the absence of the Affordable Care Act. So I think
Carina, it sounds like your internet connection might be a little weak, or you were muted there for a second. I might throw it over to someone else and we'll come back to Carina.
Rural broadband.
It is rural broadband is part of it. Please expand. We have authority here in Oregon as well, though, over our insurers. Because when we talk about the ACA, we have a tendency to think about the marketplace, but actually everybody's insurance policy has been affected by it. We have already established certain standards for insurers and even exceed the ACA with some legislation in Oregon, for example, the Reproductive Health Equity Act. But we can also, some of those important protections that are at risk pre-existing conditions, being able to keep your kid on your plan until 26. We can pass legislation to make that an insurance minimum inside of Oregon as well. We don't have to wait for the federal government. And that's something that we can do to make sure that we are meeting Oregon standards regardless of what happens in the federal government, because we need to decide what's right for Oregonians.
If I may.
Yeah, open floor. If you haven't spoken
Okay,
yet, please,
great.
please jump in. And I will use the marker of shame if you've been talking more than a minute. How about that?
Okay. Hugh here. I think that much along the lines that Eileen just noted, I'd like to see us continue to lead. We have 400,000 Oregonians that were added specifically after the ACA. And I'd hate to see any clawbacks to that, regardless of how they come about. So for me, the expansion of the program, the Medicaid expansion is important. We still don't have complete coverage throughout our state of our residents, and I think that that's necessary. But regardless of the ACA and where that goes, I think it would be good for our state to continue to lead, not follow.
Just to piggyback off of Hugh, if when we're talking about this case that was in I believe the Fifth Circuit of Appeals, that's now before the Supreme Court, there's 5 different options that could happen in this case. And let's say hypothetically, of the 5 options, the most extreme would be that the court completely invalidates the ACA or the individual mandate part, upholding the trial court's ruling. What would happen is that it would kick to the states. And I think what's really important, I mean, we've discussed about the states' role and what we could do, but what the ACA has done for especially rural areas. A lot of our clinics are funded through this, and those smaller clinics are just so huge, so important and necessary in Deschutes County and especially further out. So not only should we talk about what will happen if, let's say, that option happens, we also need to talk about what the huge hole that we would have to fill, especially in our rural areas, if that were to happen.
I'd love to hear from some of the reps in the room as well, Rep Helt or Rep Breese-Iverson.
Vikki, Representative Breese-Iverson, would you like to go first, or would you like me to go first?
I gotta find all my buttons up here, sorry. That's very kind of you, Rep Helt. I'll let you follow up if that's all right, because
okay.
I would like to point out that you are the one who sits on these committees, and you are the one who deals with this budget much more closely than I do. So I would throw out that I do believe we need to pay attention to our most vulnerable in the state of Oregon, and I do believe that we have in my district, we have a lot of emphasis on CCOs, and I think that we need to make sure that we protect those groups as well. So with that, I would thank you for that, Representative Helt, and turn it over to you.
Thank you, Representative Breese-Iverson. Thanks, Emily. I didn't know if you're calling on us in this open format, so I've just sort of been waiting my turn patiently. I think access to healthcare is one of the most important things that we need to make sure we have. That is why, as a business, we have been working with volunteers in medicine for the last 14 or so years to make sure that the doctors and nurses and staff that are volunteering have dinner on Tuesday nights. To make sure that we're doing our part as community members. As a legislator, I was proud to expand out our Medicare to more people in our state and vote for that bill that did that. That is imperative that people have access to care. It's only become more imperative as we go through a global pandemic, how much healthcare is important. And for me as a business owner, when we went into our sales dropped by 90% overnight, and my husband and I took out money out of our savings to make sure that our employees had health care and that we preserved their health care through the pandemic. And so for me, this is not a talking point. This is not something that is new to me. This is something that is ingrained inside of me and near and dear to my heart, and something I'm willing to make sure that my staff make sure all Oregonians and make sure that we're expanding healthcare. And we all have a role to play in this right now. On the ballot measure, we have a ballot measure for the cigarette tax that we all need to vote for to make sure we have the money to keep people and OHP and Medicare going in our state. So this is important and we all have a role. So thank you.
Just open floor for anybody who hasn't spoken on the question of the ACA's possible repeal and what the state can do in that case.
I think this is our first open floor experience, so we're all.
I know, I kind of like it. Everyone's like actually quite polite, but get right in there. Get right in there.
Right. You touched on it, how we were able to expand coverage for people on the Oregon Health Plan through the Affordable Care Act, and it would be an incredible setback if part of those staff funding went away. The pandemic has illustrated once again, if we're not healthy, what else really matters. We need to make sure that we're doing all we can to make sure people have access to the healthcare that we all deserve. So to me, is if there's something changing on the federal level, we have to be creative. We have to be responsive. We have to fill those gaps that are going to happen. My work at the DA's office, I see people in crisis every day. I've also seen people be able to get on the Oregon Health Plan and have health insurance for the first time, and get access to the physical health care they need and the mental health care and drug addiction services through the Oregon Health Plan. And I've seen people make incredible changes in their life when they get the supports and helps they need. We got to continue to push that program forward to make sure everybody has access to those types of services.
Just about a few seconds or a minute left in the time I had budgeted for this question. If anybody has any follow-up thoughts or wants to push back on anyone on something they've expressed.
Another thing that I would say, Emily, is that we also need to be focused on preventative care, and that's something that we're not as focused on in our medical insurance model, the way that it is. And that's one of the reasons that I think vaccines are so important, because that's very preventative care, and we really need to make sure that we are having preventable diseases be prevented. And I was proud to lead on that. And I want to thank everybody that talks to our vaccine hesitant folks every day to make sure that we get those vaccines into our young people so that we're preventing polio and measles outbreaks in our Central Oregon area.
And I'm going to jump in for like 20 seconds, if that's okay, because I finally have video and audio.
Yay!
But I also just, wanted to agree with some of these comments that this is a lot more than talking points for me as a former social worker with over 100 youth on my case. This idea of preventative medicine. We also need leaders who are going to acknowledge the systematic inequalities within our community. And I hear a lot about diversity and vulnerable communities. And so this is just another piece that I didn't hear talked about, and I just wanted to mention it.
Yeah, and Carina, you got cut out in the beginning, so if there's anything else you want to say on what the state should do in the event of the ACA is repealed, or now is the time. You're good?
I think a lot was covered, and I don't need to be super repetitive. I just wanted to add that point that we need people who understand the community value when we have to show up, how we have to support, but also we need to push further and look at the inequities and the way the state has perpetuated those with our policy, especially against BIPOC people. And then also, talking about mental health, we really need to broaden that conversation, because again, as a social worker, I didn't even realize that there was no inpatient youth services on this side of the mountain, even though I was driving the majority of the kids that I had to drive over to the other side of Mount Hood. Just that fact alone, looking at Senate District 30, that just doesn't exist, and it's the largest district in the state. That's simply not okay.
Looks like we're getting some engagement on our chat here. James Powell wants to know, while we're on this topic, if there's a feasible way for the state to separate healthcare coverage from employment, especially in the event that the ACA is revoked. I would suspect that affects a lot of our participants here. And while you're thinking about that, a few more seconds, panelists, you are welcome to use the chat to communicate views that we run out of time for, or interact with our participants directly in the chat. I know that can really be fulfilling for people. So just to extend on our question, feasible way for the state to separate healthcare coverage from employment?
Yes, there is. Several things that I'd like to see, because as I said before, I think, we should get on a glide path to single payer. And it doesn't happen in one step because, coming from a corporate environment, there is a multi-billion-dollar industry there that is not going to go down with a single vote from Congress. And I've had a great deal of luck changing things by using the free market. And one of the first steps I'd like to see is to make the Oregon Health Plan an available option for people around the marketplace. Because of my own experience in the marketplace, I would much rather pay that premium to the state to get the OHP instead of a private insurer. And one of the things that was supposed to happen with the marketplace is that freedom. But there is no, in order for the free market to work well, you have to have a willing buyer, a willing seller, and price transparency. And we don't have those things in healthcare, and we never will. So this is something that we really need to get forward in. This is one of the reasons that I believe in single payer. And the ways to do it are allow people to buy into single payer until we establish what those accruals, what those costs are, and what the formula looks like. I'd also like to see as somebody that was, the pen of shame. One more thing, as a corporate controller, corporations self-insure, they don't buy health insurance. We can self-insure our Oregon State employees and particularly our elected officials through the Oregon Health Plan. That will put the people that are making the decisions on the plan that we need to have to make the right decisions about healthcare for Oregon. Thanks, Emily.
Yeah, and keeping in mind we've got a lot of ground to cover, is there anybody else that had a radically diverging viewpoint to share? And I want to bear in mind we have 5 Democratic nominees here and 2 Republican nominees. So I may be calling on Reps Helt and Rep Breese-Iverson more often. And thank you for your patience with that. But if we're ready to move on, we'll just move on. Let's talk about the pandemic. How can we not, having a discussion about policy in 2020? How do you grade the governor's response to the pandemic? A, B, C, or D? And this is kind of a two-parter. What actions does the legislature need to take to address the public health crisis in particular? I'm tempted to throw this to one of our Republican nominees in the room, but after that, yeah, let's go ahead and do that. Rep Breese-Iverson, if you would go first, that would be great.
Thank you, but could you repeat what it is that I think I missed part of it.
How do you grade the governor's response to the pandemic, and what actions does the legislature need to take to address the public health crisis?
Well, I don't grade the governor's actions in our health pandemic great. I think that she's probably in the D range. And I think that, again, what I referred to earlier, our state is large, we're very diverse, and to treat the whole state as one scenario doesn't really speak to the diversity that happens within our different communities, especially our rural communities. From the very beginning, I suggested that we live a more social distance lifestyle. A lot of the things that were brought to attention through executive order were something that as she put that executive order together, she didn't consider how a populous area such Portland might have their restaurants intact versus how a smaller community that has less tables and more space, just because we don't like to sit quite so close to each other, how we handle things. So I think that there was a lot of lack of consideration for just the general lifestyle diversity around the state. I think that the legislative process was shut out of a lot of the executive orders, just given the sheer amount of executive orders. We could look to that. And I think that we need to talk about those executive orders and the extended period for which they are in effect. I think that the legislature should be enacted to consider extending so many of those executive orders.
I'll hop next if that's okay. So actually did grow up out here in Senate District 30 on the Warm Springs Reservation, and my people have been here since time immemorial, existing in this place before it was Oregon. And so, you know, there's a couple layers here. I would grade the governor's response as an A, because unfortunately my elected representatives and a lot of the electeds in my areas are not, you know, spreading the same messages, going off of science, helping be safe with what's really going on. And I feel like she has done her part to try and communicate, but when people are unwilling to be at the table and work, how do you do that? So there's a couple layers here where growing up out here, I realized there's this idea that there's only one viewpoint because that's what's been dominant. But I also understand that there's a lot of people who are a quiet majority. So I just want to say that I think she's really compromised. And as somebody who's been represented by people who might not grade her as well, I'm disappointed in that representation and would grade that representation a D.
Emily, this is Hugh, if I may. Two things. One, as a commissioner on the OLCC, we have worked extremely hard trying to strike a balance and keep people employed in the hospitality industry, whether it's even in the liquor stores and, believe it or not, even marijuana. So we have taken actions in which to, again, operate safely. I look at the governor and her actions to date. I would also grade her extremely high. Definitely around an A. The fact that our state was one of the first states to actually assist other states that were going through trouble sometimes, to me, speaks volumes of the leadership that was brought to the table. I also think that it's critical to understand that rural, urban does not play a factor when we're dealing with COVID as much. And in fact, I think the stakes are even higher for rural areas because we're dealing with areas that are not equipped to handle and could easily be overwhelmed from a healthcare standpoint, more easily at times. So it's unfortunate. I'm actually running against someone who's not here tonight that filed a lawsuit recently against the governor's actions, specifically on the right to not wear a mask. So we're dealing with public health and safety. And I think that it's been a top-down, very professional approach and quite measured along the way. So I'm in Carina's corner on that one.
Let's focus on the second part of the question, and we'll go to Emerson Levy first. You can briefly touch on the governor's grade, although I think we've kind of gotten a flavor of that. But the second part was, what can the state legislature do now in response, picking up of where we are now and where we're going to be in 2021?
Yeah, absolutely. And I'm going to decline to answer the first part of that question. I think that's just an easy, divisive talking point that I want really not much to do with. But what I do want to talk about is the importance of the legislature's role in public health. And specifically, when we're talking about the governor's order and the emergency ruling, which then went to the bigger court judge. And what was disappointing to me was the amount of rural, can't say that word very well, legislators that mischaracterized that ruling. So what was saying what the ruling said in the Baker Court judge is that it was regarding the statute that the governor invoked. But what was said and what was disseminated to the public that it was a strike against the First Amendment of a religion, and that's absolutely not what happened. So in that time period that, in fact, the judge's ruling said nothing about the First Amendment or the ability to practice religion. It was specifically regarding the statute that was invoked. And whether it was done properly. But instead it created this like brouhaha over something. And then what happened is over 100 people went to church and then they got sick and we're still dealing with the fallout from it. So it's not the governor's grade or whatever, it's just all of our ability to take this seriously so people don't get sick. We have 11 ICU beds in Central Oregon, that's it. Like, sorry not to get heated, but this is serious stuff and we need to take it seriously.
I'm seeing quite a bit of reaction here in the panel, so let's just stick on this topic for a minute. Carina, was that you saying you wanted to talk, or that the talking had gone on too long? I wasn't quite sure. You're muted. Okay, you're good.
I was saying I agree. Sorry.
You agree. And I saw a lot of head shaking from Rep. Breese-Iverson over there, and I wondered, would you like to push back or counterpoint without, again, devolving into a debate, but helping these healthcare professionals understand where you're coming from as a state representative?
Well, I don't want to take up Representative Helt's opportunity to weigh in on this either. I think that it is important that we talk about if you're talking to the second part of that question, we were talking about how the legislature was involved and we weren't. We were shut out, and that's the issue there.
And Rep. Helt and then Jason Kropf, we haven't heard much from either of you on this.
I want to talk about what I think we did right as a state and a legislative body. The first thing that we did when the outbreak happened in Seattle and there were 19 deaths in a nursing home facility back in February, we met with OHA and we immediately put in standards to increase sanitization inside of nursing homes. We also, and we put in positions to make sure that those sanitization standards were enforced. We also put in place a no visitation requirement so that we were able to keep people more isolated and protect them and their safety. I think that was imperative, and I think that is one of the reasons that you have seen our death rates be much lower than other states. So I want to applaud that effort by OHA, the governor's office, and the legislative body, and I was proud to be part of that. And then I want to talk about a few things that were a little bit more difficult. One, I think we need to work harder on testing supplies. I hear from many of you in our medical community on a daily basis that we need more testing supplies. I also think that as we learn to live with this virus and get back to normal, that we need testing supplies to be able to get our kids back in school safely and be able to do the medical procedures that you do every day. And I also believe that our PP&E supplies, we found out were woefully inadequate. And I was working feverishly to try and get more PP&E from everywhere possible, talking to every supply person that called my office, because I wanted to make sure all of you in the healthcare industry were protected. And it gave me a lot of heartburn that you were not protected in the beginning of this crisis. And we need to make sure that our stockpiles are built up and that we're ready for whatever wave comes next. And I think we need to work on testing supplies, and I think we need to work on our PP&E supplies to make sure that you all can do your jobs in a safe manner. Thank you.
We are definitely running out of time for this topic, but if Jason Kropf, we haven't heard from you, and I would love to if you want to.
Right. I'll try to set a record for brevity.
I love brevity. Love it.
You know, I think most importantly is you got to follow the science, right? You have to, you know, things have been changing and evolving. You know, we know people have clear information about the best ways to be safe or the best ways and the safe ways to operate a business. We can do a better job at lowering the infection rate. I think the priority going forward is we know everybody is struggling right now, but we know the impacts of COVID, both health-wise and economically, have impacted certain people to a much greater extent. We got to target resources to those who are the most impacted moving forward. That's pretty good.
Yeah, I guess the only thing I want to say is we have to remember that the individual is not powerless in this. I mean, the simple fact of the matter is if we had a drug that would reduce transmission by 70%, everybody would take it. And it's a mask. That is the best way that we are going to keep our economy open, get our schools open, is by taking personal responsibility as well. My constituents, especially here in Sunriver, are in the high-risk group, and they really welcomed the mask mandate because the tourists were coming in without that, essentially treating us as some sort of a COVID-free zone, which was trapping people in their houses. You know, this is a basic kindness that we do for each other, and I thank the health professionals for helping spread the word, because my daughter's a nurse. She's a gen med surg nurse, and she knows that she will eventually get this, and it really, really upsets her to see people just abusing common sense and common decency.
Well, thank you everyone for that. I know that was a big question with a lot of contention of the last 8 months packed into it. So I appreciate this open format and getting to hear from so many different voices across our region. I want to pivot now to a question I got from one of the society members talking about something that makes their life harder and makes it harder for them to care for patients. Prior authorizations that make providers get approval from insurers before they can take certain treatments or prescribe certain things. I've been told that's a burden and it's driving up costs for the providers. What do you think the state legislature can do to improve that system? And this is totally carte blanche, whoever wants to jump in.
I'll go ahead and go because it doesn't look like anyone is jumping forward. So I'll fill this space. As a small business owner, I know all of you are small business owners too. We have to be careful of the regulations that we put on our small businesses. And we need to be mindful of making sure that we reach out to people and understand what it is that you need and what it is that the state needs for information. We need to make sure that we are working with you and not against you. Because we can get information from you in easier formats, in simpler ways, in more cost-effective ways, because a lot of the data we ask for is not even processed because there's not enough FTE on the government side to do with what it is that's being asked. And so we need to make sure we slim down our requests to only the data that we need, and we need to make sure we're doing it in a mindful way and that we have systems that are easy and accessible for you to use, because you're seeing patients at 15-minute increments. I now know what that feels like, having been in the legislature for 2 years. 15-minute appointments are fast and furious, and you go from one topic to the next, which you all do so fluidly, and we need to be mindful of your time so that you have more time to spend with those patients and ask them how they're feeling. Because I know that one of the most loaded questions today through the pandemic is asking people how they are. I remember Emily called me maybe last month to ask me a question, and I said, "How are you?" And we had a 5 to 10 minute conversation just about how we all felt about each other, felt about our day. And it's important that we're able to have that time to do those mental health check-ins as people are struggling. And so we need to be mindful of what we're asking. We need to make sure that we're working with you so that the data that we're asking is easily deliverable on your part and you can spend more time with your patients.
Thank you for that, Rep. Help. And I would say maybe the bigger picture that I'm getting out of this question about prior authorization is how will you as state legislatures advocate for medical providers to improve their patient care and for their jobs to be easier and safer over, say, the interests of the insurance industry, which is driving prior authorizations? That might be a less specific way to frame this and engage you guys. Still crickets?
Well,
Yeah.
Go ahead.
prior authorization is also a pain in the butt for our patients. We really need to establish a clearer, you work on protocols, right? I like creativity. I never could be a successful medical provider because you do need to follow those protocols. But they should be based on medical necessity, not on the insurance company's ease. And I think we just need to give a greater voice to both patient advocates and to healthcare providers, including our PAs and our nurse practitioners, about what those appropriate protocols are, and not have to be second guessed when we know there is an established treatment protocol for this.
Emerson Levy, did you want to get in there?
Yeah, thanks, Emily. I was just picking back off that is that we need to put the patient's need first and the efficiencies in our systems and our software systems first over insurance, but that's very difficult when there's a lot of insurance money pouring into the legislator. And I'd also, can we pivot and answer Charlotte's question? Or are we going to get to that? Regarding...
Yeah, you're welcome to introduce that new question. Yeah, I was struggling with how to bring it up without. It's a question in the chat that we're talking about.
Yeah, so it's
specific bill.
So specifically on this, the House Bill 4212. So I know that this is a huge issue. I hear it a lot because now my husband works from home and he is actually hospital attorney specifically. His specialization is in HIPAA, and this is a huge issue, meeting after meeting on this specific issue. And their main complaint is it seems like no healthcare providers were invited into the conversation. Now, I don't know if that's true, but I think it's, yes, I think this is a big issue. I know that people have this, deal with this a lot. It's probably easier to read her question for those who can, in the interest of time. We need to rework that bill because I know as someone's partner who specializes in HIPAA, there's a lot of missteps in that bill.
And we're talking about a rule, an OHA rule that would require primary health providers to collect race, ethnicity, language, and disability information on all patients. And this person's question is specifically concerned with privacy and HIPAA laws, although I think there's a lot of conversation to be had around collecting that kind of data around COVID-19 and understanding inequities. So perhaps now's a good time to kind of open the floor back up to this rule, and also if you want to address specifically what's in the chat, it is quite specific. But.
I know it's quite a specific question, but I guess it's a general thing of talking about just when we're making these kind of legislation to make sure that we bring all the right people to the table so that their interests are heard, and just on the practical side of what that looks like for our healthcare providers.
And Emily, to your point, hang on a sec. I think that your initial question as to authorization and pre-authorization, that's another area where the legislature can actually play a key role in bringing people together and having that conversation and hammering out those details as opposed to letting them just be kind of independent on their own. The legislature can actually work towards bringing those to the table, very much like this. So.
Emily, I'd like to give an example of something that I have done working with all of our surgery centers. The governor put an executive order in that was banning elective surgeries, and everyone in this Zoom call knows that elective surgeries are not necessarily elective. Gallbladder surgery is not something I would consider elective. Neither is back surgery. But those procedures were elective, and our physicians were not able to, and surgeons and doctors and nurses were not able to provide the services that they needed to provide to their patients. So I wrote a letter and worked with our surgery centers and worked with our governor to get those requirements of banning those procedures removed and opened back up May 1st. That's the type of leadership that I like to bring to the table, is working with the people that are working in the field, listening to what they need for their patients, and bringing forward solutions. I don't think you can bring forward solution. I think this problem illustrates legislators bringing forward solutions without talking with providers. And that is exactly the opposite of what I like to do. I like to work with the people who are working in the field, get that conversation moving, and bring forward the solutions that need to be brought forward by working together in a bipartisan way. Thank you.
Rep. Helt, you've set us up beautifully for the last question I wanted to reserve for the end of this. And thank you all for your patience. A forum with 7 people is not the world's most satisfying way to human interact. And you've all been stars, and I appreciate you for taking part of this and communicating with the medical society. The last question I had was actually just to kind of let each of you make a direct pitch to the people in this room about why voting for you is going to help their job be easier, safer, and improve outcomes for patients. And I think we just heard a bit about that from Rep. Helt, so I'd like to go to someone else in the room.
Oh shoot, we have to go first. All right. I'm the mom of a nurse. She's a general med-surg nurse at Duke University Hospital. She's also a nurse educator. And I hear from her over and over again about the loads and the workload and how she's preparing her students to handle this. You know, I think one of the important issues that I feel is that there needs to be safe staffing. We need to have enough people. Her hospital is very concerned about having enough staffing to support patient safety, and that's great. But it's not about the caregivers' safety as well. I think you're probably very familiar with how difficult it is to get time off, to make sure that somebody's covering your shifts and your calls. we need to find a way, and I think part of this way is supporting our nurse practitioners and our PAs and what they are able to do so that we are allowed, so that we simply have more people dealing with this increasing population that is out there as well. And I think, you know, I am not an expert at it from your field. I know what I've learned from my daughter, and I look forward to working with you and finding out how we can increase the number of providers in Central Oregon, and especially in all of our rural areas of Oregon, because that burnout issue costs all of us. And this is a way that I want to learn how to support our medical professions.
Let's cut over to whoever wants to go next. Just pop right in there.
I can jump in if that's okay.
Yeah.
I just wanted to say that, you know, I think for me, really understanding my background, that I am somebody who comes from the most vulnerable population, and my passion for running comes from my direct experience with children and families and the lack of access to health across the board. And so, you know, I understand that we have to look at some of the deep things like the pandemics with missing and murdered Indigenous women, like the institutional racism that I've talked about, but I also obviously want to represent everybody in this district. And that does mean strengthening resources, strengthening funding for health access and all of these things, you know? And so the part about the health crisis too is just having elected officials who do communicate clearly what the actual issues are and what the policies that are being passed actually are, and move forward in the safest, most responsible way. And that's what I want to do. So I do appreciate what the state representative said about working with people directly on the front lines and taking back what they need, because I understand that as electeds, we don't always know, and we're not always the experts, and the way things are coming in, we don't know how they're going to impact people. So these relationships between organizations, or the relationships we have with our daughters or our friends who are nurses, who are social workers, those are the keys to how we're going to lead and lead responsibly.
Let's go up to Hugh. What's your direct pitch to medical professionals? Why should they vote for you? How are you going to improve their professional lives and their patient outcomes?
Yeah, indeed. Thank you, Emily. I think these are tough times ahead. Difficult decisions are going to be required of us in the legislature. I think in a post-COVID landscape, when we look at healthcare, we have a tall order in front of us, especially in rural areas where just staffing levels and maintaining and retaining staff is going to be so important. I think something that we didn't get a chance to touch on tonight, and I think it really compounds the issue, is homelessness and mental health issues. I think we need to reinvest more heavily in what we provide for mental health, because to see a mental health crisis routinely find its way into the emergency rooms of our hospitals really is not doing us any good. And then lastly, I think by 2030, I think there's estimates that 1 in 5 Americans will be 65 plus. So we're dealing with an aging America. And that's something I think we can no longer avert our eyes. We're going to need legislators that can actually stay in the room and do the hard work and actually make the tough calls. And that's going to be important in the days ahead. So you need to have someone that's passionate and it's going to listen. Thank you.
Emerson Levy, what's your pitch to voters here?
Yeah, thank you. Again, thanks everyone for being here and for spending your evening with us. You know, my pitch is that, you know, I will, like a lot of the representatives and candidates here, it's about bringing people together and people who have the information to the table so that we can have a discussion. You know, I've gotten a lot of pushback in the last week that I'm maybe too young to run for the legislator, but I have a business degree, I have a law degree, and I understand the burden of degrees and how that keeps people from getting into the field because they have a high debt burden. I think we need to address that so we can get more medical doctors in the field. And also, I realize that we just hit the first medical recession for the first time, I believe, since the early 1930s. I'm not sure on the date on that one, but it's one of the first medical recessions we've had in a long time. And again, and that goes back to what Representative Helt was saying about the lack of elective surgery. So I understand that you're running a business and that and that it matters, but I also know that you got into this because you care about people. And I think the best thing that we can do as a legislator is to bring you to the table, but to also get out of your way to put the health and wellness of people first. Thank you.
Let's hear from Jason Kropf next.
Thanks, thanks Emily, and thanks everybody for being here this evening, and thanks to the other candidates. Nice to see everybody's faces today. So I am grateful, and I'm proud to say that I'm a product of public education here in Oregon, from high school to college to law school, and grateful for the investment that Oregon made in me and the life that Oregon, those investments helped make for me. And I've honored that investment by a career in service, and I've chosen to be in our criminal justice system and our juvenile justice system, and I see people in crisis every day, people who haven't had that level of investment, people who haven't had real educational opportunities or economic opportunities, people who lack access to healthcare, access to mental health care, and people who really struggle with housing and meeting their basic needs. You know, I believe that we can do better and that we have to do better. And to me, that means making sure that we are helping those people in crisis. It means making sure that we're doing a better job of providing that social safety net. It means making sure we have a school system that works for all kids, making sure that we're tackling affordable housing from all angles, and making sure that we're really pushing to make sure everybody has access to healthcare and mental health care. You know, I think if we did that, took a holistic approach to well-being and health in our community, we'd have a safer, more just, and healthier community. We'd get greater value from the dollars that we spend on direct healthcare costs, and we have a healthier, more robust community. So to me, it's about supporting our medical providers, making sure they have the tools that they need to do their jobs in this incredibly difficult time. But it's also about how do we make sure everybody is safe and stable so we can have that kind of healthy community that we all want.
Rep. Breese-Iverson, could we hear from you now?
Thank you. I just want to say that I love the rural way of life that I represent in my district. One size does not fit all of Oregon. And the medical providers in my district are my neighbors, and they're important members of my communities. They need to be at the table when we make decisions considering future legislation. My door is open and I invite you in. Thank you.
Short and sweet. I love it. Rep. Helt, last word on this pitch goes to you. Oh, you're on mute.
Thank you, Emily. I just want to close out thanking our medical community for putting their service above themselves through this pandemic. It has really warmed my heart to see the care that you've given our community, and I appreciate it deeply. I want to really just say to you, I'm not asking you to trust me, that I will work hard for you. I have demonstrated that I will work hard for you. I have taken on science deniers to bring forward vaccine legislation and ensure that we protect our kids from dangerous diseases. You all know what that means and how difficult of a bill that was and how much courage that took. And I am here to bring forward that bill again and have that same courage moving forward. I would love to complete that work, and I would love your support on that. I also brought forward bills to ban flavored vaping. I took on the tobacco lobby to do that. That also takes, again, a lot of courage. My record is extremely strong in public health before the pandemic. After the pandemic, I stood up and have worked tirelessly to get more PPE for you. I have worked hard to make sure that we work on a testing protocol, and I hope that I have earned your support because I want to continue this work alongside of you as I have in the last session. So thank you for your time and your dedication to our community.
Thank you so much to all the candidates for being here today. If you want more information about who you've been hearing about, they all have websites, they all have Facebook pages with a lot of great information. And it's been my honor to moderate this very complicated pandemic reality. I can't wait to retire the pen of shame and be in the same room with all of you again and have some snacks while we do this. So until that day, thank you so much for your patience and for rolling with the punches. And I'm going to turn it back over to Amy Tatum.
I want to thank all of you candidates so much for showing up tonight. I have been in your shoes. I know running a campaign is really hard. It's a lot of work. It is emotional ups and downs. It is self-doubt. And I thank all of you so much for putting yourselves out there. I hope you know whatever happens on election day, you have worked hard. You've made our community proud by standing up and you know, saying you matter. So thank you so much for joining us tonight. Emily, thank you so much for moderating, and make sure everyone votes because it is so important. We don't have to agree, but we all have to make our voices heard because that is the foundation of our democracy. So thank you so much for joining us tonight. Have a wonderful evening.
Thank you, Amy.